guys, welcome to my channel where I balance my life and hormones. I'm Mary Cherry, and your Valentine's Day is right around the corner. I am so excited, and if you are trying to get pregnant on Valentine's Day, this video is for you. Or if you are planning to get pregnant anytime soon, I think you're going to find this video very helpful. So I'm going to first talk about 4 things you can purchase to help you conceive, and then 2 tips that I learned when I was trying to conceive. So the first thing you should purchase are prenatals. Prenatals for mommy is super important. I really recommend mommies to start taking prenatals 3 months before they start trying, but anytime it's going to be helpful. You just want to make sure that the mommy is getting in complete nutrition for herself and the baby. So any type of nutrition deficiency could hurt mommy or somehow causing birth defects for the baby. So it's really important that you do take prenatals. The second thing is for a daddy to start taking multivitamins. Now, I say it's important for a daddy to start taking multivitamins because daddy's health does play an important role in the quality and quantity of sperm. So if daddy is healthy, then more likely his sperm mobility, the quantity, and the quality would be very good. That increases the chances of conceiving. Now, the last 2 things that I recommend are optional. You don't have to buy these, but it could be helpful for you in your process and trying to get pregnant. So I recommend you to purchase ovulation test strips. Now, this is really important for women who really do not know when they are ovulating. I'm going to talk about some signs to see if you are ovulating, but if this is your first time or you're just not sure when you're ovulating, I really do recommend you purchase test strips. You can get them from Amazon or anywhere around you, like Walgreens, Walmart, Rite Aid, Target. They also sell ovulation test strips. And in my description box, I'm going to send you a link to the items that I purchased when I was trying to get pregnant. And the last thing I recommend you to purchase, of course, pregnancy tests. So pregnancy tests are very effective to tell you if you are pregnant. Now, you have to read the directions. You can't just have sex one day and test for the next day. That's not how it works. So you really want to try to take the pregnancy test at least 2 weeks after you can, or try to conceive. So 2 weeks after you have sex. Or I should say 2 weeks after you have the ovulation period, that window. But it's really recommended to take the pregnancy test after you miss your period. Now, this could be challenging for some women like myself who do not have regular periods. So one of the most effective ways to see if you're pregnant is to take a blood test. Now, you can't do this at home, obviously. I would recommend you go to your doctors and ask to take a blood test, but obviously time will tell. If you conceived on February 14th, a month later, you might be able to go to your doctors or take a pregnancy test then to see if you are pregnant. Now, I'm going to tell you 2 things that I learned when I was trying to get pregnant. So, the first thing I learned is that sperm can stay alive in a woman's body for 5 days. Yes, 5 days. So that's so awesome to know because you don't have to have sex every day, or you don't have to always plan the exact day you have sex to get pregnant. So if you know the window of ovulation, I will recommend that you do start having sex about a week or 5 days before you ovulate, and then wait every 2 to 3 days to have sex again. Now, this way you don't have to have sex every day or every other day. You can kind of spread it out because you're giving, the sperm is going to be staying inside your body. When you do ovulate, the sperm's already there and ready to fertilize the egg. Now, and I do not recommend that you have sex every day. You want to give your man a break because your man has to rejuvenate the sperm and give him some time to get himself together. So do not have sex every day if you can prevent that. So try to do it every other day, or like I said, 2 to 3 days. And then when the ovulation window happens, maybe have sex again a day or 2 after that. You just want to make sure there's enough sperm in your body and that egg is there to receive the sperm. The second thing I want to share with you guys too is that there is an ovulation window. And how do you know if you're ovulating? Now, if you haven't been tracking your menstrual cycle, that's fine. There are a lot of ways to know if you are ovulating, but I'm going to share 4 things with you. So you might be ovulating if, as a woman, you just have that sexual desire or urge to have sex. So when you're ovulating, your luteinizing hormone surges, and that just gives you this desire, this feeling to want to have sex. So if for a couple of days of the month, you're like, oh my God, I just really, really want to have sex. That's your body way of telling you, like, yo, I got this egg ready for you. I'm going to need you to get some sperm to fertilize this egg. So if you just have this intense urge to have sex, that might be a sign that you're ovulating. Another sign that you're ovulating is that when you use the bathroom and you wipe yourself, you might see or kind of feel yourself being slippery. So that is cervical mucus, and what I like to call it is that your natural body way of creating lube. So the cervical mucus or lube is just mucus inside of your body that helps the sperm, when it enters, just slide into the DM or slide into the egg to fertilize it. So and you might also realize a few days before you ovulate, you might see some like white ball leaves or like cottage cheese type discharge from you. That's a sign that your body is working itself up to ovulation day. So when your discharge or your cervical mucus is just like nice and clear and slippery, that could be a good sign that you are ovulating or you're about to ovulate. Now, the third way to see if you're ovulating is to check the positioning of your cervix. So your cervix, if it's not ovulating, if it's a normal day, it might feel like the tip of your nose. So your nose is soft, but it's also pretty firm too. But when you're ovulating, your cervix is pretty moist because of the cervical mucus, and it's also as soft as your lips. So it's a pretty soft feeling if you're ovulating. So I would recommend, if you have short nails, to put a finger or two inside of you, and if it feels pretty soft and moist and wet, that's a good sign that you're ovulating. But if it's pretty tough or hard and it's pretty dry, that's a good sign that you may not be ovulating just yet. And the fourth sign to show that you might be ovulating is something called ovulation spotting. So what that means is, and it's pretty rare for this, I shouldn't say rare, but it doesn't happen, it's not a common thing to happen in women, but sometimes when a woman ovulates, she does have some spotting. Now you might get this confused with you might be menstruating, but no, this spotting is caused by ovulation. And in my research, it doesn't really have a clear reason why there is spotting involved, but that's another sign that you're ovulating. Now, if you Google this, there's a ton of ways to know that you're ovulating. Any type of pain or cramping, or if you're cramping. Also, if you have any soreness or tenderness in your breast, there are also ovulation signs. But ovulation signs are different in every woman, so you really have to read your body signs and see. But honestly, the 4 ways that I just told you are pretty good indications, minus the bleeding, because that's pretty uncommon. But those 3 signs of your cervical mucus, your sexual desire increases, and the position of your cervix are really, really good signs that you are ovulating. So I say this because this weekend, if you're trying to get pregnant, these are just some things to think about. If you just got in your period, then that's considered your day 1 of your cycle, and you have some time to build up to get to that ovulation window. And I'll just quickly go over the 4 stages of your cycle if you are not familiar with this. So there's 4 stages in your cycle, and the first one is your menstrual period. So that's pretty self-explanatory. The second part is the follicular phase. During this phase, that's when your body is maturing and growing the follicle to release the egg. And then it's time for ovulation. So it's the 3rd phase of your cycle. Commonly, women will say this is your day 14, and that's if you are on a 28-day cycle. Everyone's cycle is a little different. It may be a little longer, a little shorter than 28 days, but usually the advice is that women have sex around day 14. That is a pretty, it's not customized to you, so you can follow that rule, and you may get pregnant during that time, but I would recommend just to scale it back a few days and scale it a few days after the 14th day of your cycle. But really look for the signs and symptoms I told you if you're ovulating. And then the very last stage is your luteal phase. So during your luteal phase, this is when your body has became pregnant and is preparing for implantation, meaning that the egg is going to be kind of snuggle into your uterine lining for the baby to grow. Or if your egg wasn't fertilized, then your body is preparing for your menstrual cycle. for that bleed to happen, to release the unfertilized egg and to release your lining. So that is your cycle. If you are trying to get pregnant, these are the things you should be looking out for. In my description box, I'm going to be also linking my handout that I have, 5 ways to supercharge your fertility. And I'm also going to be offering my weekly fertility call. So this Sunday is Valentine's Day. We're going to do something really special. So at 7 a.m. I'm doing my weekly fertility call as usual, where I say I welcome any prayer requests, say a little message about God, and then we get into our prayer call together. And at that time, it's just getting open for women. But also at 8 a.m. Eastern Standard Time, we're going to open up to couples. My husband's going to join us on this call, and we're going to pray for couples during this time of trying. So I welcome you guys to join both or one of these fertility calls. The information will be below in this description box. So I hope you guys can join this. I hope this video was very helpful for you guys. I hope you guys get pregnant this Valentine's Day or in the upcoming weeks. And I would just say this: if you get pregnant this weekend during Valentine's Day, you might have a Scorpio baby. So my sister's birthday is November 14th. I'm ashamed to say this. That means that when my parents were trying to get it on, they got it done during Valentine's Day. So Valentine's Day is such a special time of the year. And just know, if you do conceive during this time, then 9 months in the future, it's going to be a Scorpio. The baby's going to be born in November. So good luck with you guys. Hope you found this video very helpful. If you think someone else is trying to get pregnant and you think they will benefit from this, make sure you share this video to them. Make sure you like and subscribe, and I will see you in the next video. Bye.